Hello, my name is Dave Ryerse, CEO here at South Lincoln Hospital District. I'm pleasured to be joined with Dr. Krell, our Chief Medical Officer, and Michelle Pollard, our Board Chair. Today we had a couple of announcements that we wanted to provide to our community of some updates that we have regarding our organization. For the past 2 years, our organization has been dealing with the COVID pandemic. The last 5 to 6 months has been, as you know, very critical in the latest variants that we've dealt with COVID. Along with these challenges that we've had, it's been concerning to see the staff impacts that we've had to deal with during these times. In particularly, our challenges in these areas have not gotten better. For the last 5 months in our OR especially, we've had some challenges with maintaining appropriate staffing levels in the area. With that being said, our board and our medical teams have been meeting to try to overcome and figure out additional opportunities to get through these challenging times. Our board ended up meeting last night and made the determination that as effective of June 1st, our OR will no longer be on call. With that decision, there are impacts to some of our services, including the ability to have OB services delivery here in our community. We know that's impactful for our folks. As such, we've connected with our patients this morning. We have 5 patients in our immediate area that we have connected with and informed them of these changes effective June 1st. We've also informed our staff of these changes and are working to inform our community about these impacts to the organization that we're experiencing. Dr. Krell, I don't know if you had what you had on that.
I think you covered most of what we had to say. This does mean that for certain things and certain surgical emergencies, we won't be able to handle them immediately here, and we may need to do some transfers. Some things can certainly wait until the next day, and we can do that during daytime hours there, so that will be possible. It's just as you said, Dave, the one that we just can't do is we can't be delivering babies if we don't have 24/7 immediate capability to do a C-section, and so it's kind of sad after having done that for a very long time here. We've delivered babies in Kimmer for well over 80 years at this point, and at this point we're going to have to suspend that. So I'm sorry for that. We'll still certainly be more than happy to try and do everything we can for all other family things, and it may be possible to arrange partial prenatal care here before delivery, and certainly as usual we're happy to take care of the newborns, but the actual deliveries we are going to have to hold off on being able to do at this time.
Thank you. Michelle?
I guess I just wanted to say that the Board of Directors did not take this decision lightly. We've met 3 times at least on this particular topic. We don't take it lightly. We've believe we've done our due diligence in trying to mitigate all of the factors that have come to us with OB, OR, and really our staffing. We're in a critical staffing shortage right now, and that really is driving a lot of our business decisions. We're trying to make the best decisions for the community. And so we didn't take it lightly. We continue not to take it lightly. We will continue to do the best job that we can do for the community. But the decision was made last night to suspend OR on-call coverage, and that does have some impacts to OB. Our patients have been contacted, like Dave said and Dr. Krell said. So just wanted you to know that the Board of Directors that represent the community don't take this decision lightly.
Thank you, Michelle. Appreciate that. The other announcement that I wanted to present today to our community is we enjoyed in the past our annual health fair. And as I've mentioned, with the COVID pandemic that we've been working through, our supply chain to have the basic tests that we would typically have at this time of year to provide those services has not been a sustainable portion of what we've been able to ascertain as far as getting the lab test in order to provide our health fair. That's been a difficult determination that we haven't been able to get those supplies in, and as such we will not be hosting as usual our annual health fair. We've been working hard, and our teams have been working hard to solidify our supply chain, and that's been an issue that's impacted all healthcare, and especially all hospitals, of trying to continue to provide normal services through the healthcare pandemic. So we're hopeful to have something at a future date, and would encourage our patients certainly to connect with your primary care provider, making sure that you have the health, that they would, obviously we will take care of you, the health care that you need, and any potential blood work that you typically would experience at this point of the year. So encourage you to do that, to connect with our primary care providers on that.
If I could, at this point, we do still have some labs, including some reference labs we have to send lab tests to, that are able to get lab chemicals to perform lab testing. It's just being able to get enough to do 1,000 tests at this point is just not feasible. We know this is happening in a lot of other places. We've been getting phone calls from labs and hospitals in Idaho and Montana and Washington trying to buy our lab chemicals because they're out too. It's a national problem, but everybody seems to have some. They just don't have enough. So we will still be able to get tests done on an emergent basis, and some of them we do have to send away that we didn't in the past. But hopefully we'll be able to get the supply chain issues fixed, but just not fast enough for health fair this year.
Right. So appreciate having to spend a few moments with you today. There'll be additional information and additional fact sheets that'll be coming out. Certainly we welcome feedback, and as we work to provide the care in our area here. Our patient experience expert David Cohen is also available. His direct line is 307-800-8656. So we welcome that, and again we appreciate the opportunity we have to spend a few moments with you on these important updates around South Lincoln Hospital District.